Introduction. Welcome to today's lesson on the structure, function, mechanisms of action, and clinical applications of drugs targeting DNA gyrase and topoisomerases. In this comprehensive script, we will delve into the intricate details of these topics, providing a thorough understanding of the pharmacology and therapeutic significance of these agents. So let's begin. To comprehend the mechanisms of action of drugs targeting DNA gyrase and topoisomerases, we must first understand their structure and function. DNA gyrase, a type 2 topoisomerase, plays a vital role in controlling DNA supercoiling by catalyzing the introduction of negative supercoils into double-stranded DNA. On the other hand, topoisomerases 1 and 4 are involved in processes such as DNA replication, transcription, and recombination. Understanding the unique structure and catalytic activities of these enzymes is crucial in developing efficacious drugs. Now that we comprehend the structure and function of DNA gyrase and topoisomerases, let's dive into the mechanisms by which drugs target and inhibit their activities. Fluoroquinolones, for instance, inhibit DNA gyrase by binding to the A subunit of the enzyme and interfering with its ATPase activity. This prevents DNA replication and leads to bacterial cell death. Similarly, other classes of drugs, such as aminocoumarins and quinazolinediones, target various steps in the catalytic cycle of topoisomerases, effectively disrupting DNA replication and repair processes. To design drugs with high specificity and efficacy, it is essential to understand the structural features of DNA gyrase and topoisomerase drug complexes. High-resolution structural studies have revealed critical binding sites and interactions of drugs with these enzymes. For instance, crystallographic studies have shown the interaction between fluoroquinolones and key residues within the ATPase domain of DNA gyrase, providing insights into the inhibition mechanism. Detailed structural analysis assists medicinal chemists in designing optimized drug candidates with enhanced activity. Numerous classes of drugs selectively target DNA gyrase and topoisomerases. These include but are not limited to fluoroquinolones, aminocoumarins, quinazolinediones, and anthracyclines. Each class exerts its pharmacological effects through distinct mechanisms of action, which may involve interactions with different domains of the enzymes or DNA. Understanding these diverse drug classes is crucial in selecting the appropriate agent for specific clinical situations or combating drug resistance. To effectively use drugs targeting DNA gyrase and topoisomerases, it is essential to grasp their pharmacokinetic and pharmacodynamic properties. Absorption, distribution, metabolism, and elimination of these agents greatly influence their efficacy and safety profiles. Moreover, understanding their mechanism of action helps predict the pharmacodynamic parameters required for optimal bacterial killing. Factors such as half-life, drug-drug interactions, and tissue penetration must also be considered during treatment regimens. The clinical applications of drugs targeting DNA gyrase and topoisomerases are diverse. These agents find utility in treating bacterial infections, particularly those caused by gram-negative bacteria, such as Escherichia coli. Additionally, certain topoisomerase inhibitors may exhibit anti-cancer properties, acting against malignancies involving DNA replication and repair processes. In this section, we will delve into the specific therapeutic indications and considerations for using these drugs in clinical settings. Like any pharmacological agent, drugs targeting DNA gyrase and topoisomerases can elicit adverse effects and interact with other medicines. Common side effects include gastrointestinal disturbances, skin reactions, and central nervous system effects. Moreover, these agents may interact with certain drug classes, such as macrolides and calcium channel blockers, leading to potentially severe consequences. Recognizing and managing these adverse effects and drug interactions are fundamental for ensuring patient safety. Despite their efficacy, the emergence of bacterial resistance poses a significant challenge in targeting DNA gyrase and topoisomerases. Bacteria can acquire resistance through various mechanisms, including mutations in the drug target sites, efflux pumps, or plasmid-mediated resistance genes. Understanding these resistance mechanisms is vital for the development of strategies to overcome or prevent resistance. Additionally, the constant evolution of resistant strains necessitates ongoing surveillance and novel treatment approaches. Advances in drug development and design have significantly contributed to improving the potency, specificity, and resistance profile of DNA gyrase and topoisomerase inhibitors. Researchers employ techniques such as structure-based drug design, virtual screening, and combinatorial chemistry to identify new chemical entities with enhanced activity against the target enzymes. Furthermore, harnessing novel drug delivery systems and prodrug strategies ensures optimal drug exposure and therapeutic outcomes. The use of combination therapy involving drugs targeting DNA gyrase and topoisomerases has gained prominence in combating resistance and enhancing treatment efficacy. By combining agents with different mechanisms of action, synergistic effects can be achieved, allowing for lower dosages and reducing the likelihood of resistance emergence. We will explore various combination strategies employed in different clinical scenarios, including the optimization of drug combinations and their therapeutic implications. Regulatory authorities play a pivotal role in ensuring the safety and efficacy of drugs targeting DNA gyrase and topoisomerases. This section will provide an overview of the guidelines and regulations that govern the development, registration, and post-marketing surveillance of these agents. The importance of preclinical and clinical studies, adherence to ethical guidelines, and post-marketing monitoring will be discussed, highlighting the significance of adhering to regulatory standards. The use of drugs targeting DNA gyrase and topoisomerases raises ethical considerations and public health implications. Balancing the need for effective treatment options with the potential risks of promoting drug resistance requires careful evaluation. Additionally, the accessibility, affordability, and equitable distribution of these drugs are crucial for ensuring global health outcomes. Ethical dilemmas surrounding clinical trials and potential conflicts of interest in the pharmaceutical industry will also be discussed. In summary, this video has covered the important aspects of drugs targeting bacterial DNA gyrase and topoisomerases. We have discussed their mechanisms of action, clinical applications, adverse effects, resistance mechanisms, and advancements in drug development. This knowledge will help healthcare professionals make informed decisions about their use.